Hey guys, Dr. Rodney White here with Sapi Chiropractic, and once again I'm joined by Michelle McCaslin from Functional Heartland Medicine Heartland Functional Medicine, and if you come in here you'll have seen them across the hall. So today we're going to talk about hormones because it's a very, very, very misunderstood issue, especially for women. You know, there's that adage, you hit menopause, you go on hormone replacement therapy, and Michelle's going to jump in and explain why that's so wrong, even if just for the cancer risk that comes with it. But over to you, Michelle. Let's talk hormones.
All right, so hormones. I do take care of a lot of women that come into my office thinking that they need hormones. Hormones, like Dr. Wright was saying, do come with risks. And so the way I approach hormones is verifying diet, the gut status, liver status, amount of chemicals, and maybe verification of thyroid, which we'll talk again later about. And so with diet, if you're eating a lot of sugars in your diet, that can do yourself an injustice if you are already trending with low hormones, because the sugars will change the way the hormones are being metabolized, so to speak. And so you will be at a lower set point with your female hormones. So cutting out the simple carbs and sugars as you change with your hormones is very important.
When something you said to me earlier, Michelle, off camera, hormones, the level is a snapshot of right where you are, right? So if you've exercised, your hormones will be different. If your diet is full of garbage, it's off, right? So just fixing
hormones
the hormones
fluctuate like this.
So they're kind of like back pain being the symptom because of a disc problem or mechanics.
Right.
Okay, so we can't just go and slap hormones into the body and hope that's going to fix it.
No, because like you were saying, it's one point in time, and when females are already going through perimenopause, during the mid-30s, you can be changing with your hormones. So depending on when the blood work is done, your hormones are just kind of going up and down, so you don't really get a true snapshot of what's going on hormone-wise.
So someone like you manages it differently. How?
I make sure, one, the diet is good and supportive to hormones. If somebody is with a thyroid issue, so balancing other hormones as well too can help. Vitamin D, which we just talked about in a previous video, also is very important, where some people think they need hormones, but it's actually vitamin D that they could actually support, which helps your other hormones as well too.
Do you find that most medical practitioners, either nurse practitioners like yourself or MDs, if they're not from a functional medicine standpoint, do they usually understand this?
Not necessarily.
Okay.
But
I know you don't want to throw anyone under the bus, but so I guess the point I'm getting at is if the viewer goes to someone who practices functional medicine, by nature they're going to look at the whole body rather than just a hormone level, right?
Yes.
And there was one other thing you said to me off camera. You used to see a lot of perimenopausal and menopausal age women with hormone issues, and that was kind of the predominant piece. What are you noticing now?
I'm noticing changes and fluctuation of my patient population is going more towards pediatrics and teens, where PCOS and hormone-related issues are becoming rampant. 40
years ago, was that the issue?
Probably not.
Right, so why do you think that is?
Possibly the environment. I think it's our exposures. There was a time when I would give a talk for another office that I worked for related to chemicals, and one of the statistics was that a baby was born with 240 chemicals in their cord blood. That was 10 years ago.
So it's only getting worse.
So what is it now? And the chemicals are labeled by our government as endocrine disruptors, which the endocrine system is your hormones.
So if you have a teenager or a kid who has ADHD or lack of energy or something else like that, they're not too young to get their hormones checked and find out what maybe needs to be done.
Checked, yeah, or verification of diet. You know, choices in what you put in the body, definitely. If you're eating certain things that are affecting hormones.
Which hopefully most of our viewers have seen enough of our nutritional videos to know that that's a big effect. So Michelle, thanks for your time today. This I think has been very effective. If you or someone you know is going through menopause, has lack of energy or potential hormone issues, or your doctor has wanted to put you on hormones, it might be worth a second opinion with someone like Michelle just to make sure that that really is what you should be doing. So that's all we have for today. We'll see you next time.